start of National Rehabilitation Week. We are here with Kristin VanderArk, a physical therapist, neurologic certified and brain injury specialist with Spectrum Health. And so let's talk about that. People might not know about this. Why have this extra focus on rehabilitation right now?
Sure, that's a great question. So National Rehabilitation Week is an opportunity to really highlight the benefits of rehab. For me, my passion is brain injury and stroke rehab, but it's really bigger than that too. You can think about physical, occupational, and speech therapy as beneficial for recovering from illness, from injury, from hospitalization. For me, it's about a person taking their first step, maybe, in that exciting moment. But it's bigger than that. It's about injuries related to muscle or joint. Spectrum has over 500 employees in rehab that can offer a lot of specialties.
It's pretty wide when you think about it. And I think that how rehabilitation is looked at today compared to how it used to has really changed a lot. We're going to talk about some of the programs that are available to people in a minute. But let's talk about those changes and how we see it compared to maybe how it used to be done 25 years ago.
Oh, sure. That's a good point. What I think of when you mention that is just how much more specialty there is and how much more specialization. So in brain injury rehab, I have a certified specialty in brain injury rehab. One specialty that's available is available to any professional who works with brain injured patients. Spectrum has 90 of those type of people who have achieved that certification. And then there's another specialty specific to physical therapists offered by the American Physical Therapy Association. That's more specialized. There are less than 20 of us in the state of Michigan who have that certification. So that's exciting to be able to offer that specialized care, to be able to really promote the best practice in brain injury rehab.
Yeah, and I feel like what's being done now and some of the programs are a little, what people might not realize, a little out of the box. We showed some really beautiful video of music therapy and how that can really help a person going through rehabilitation. Can you explain the importance and how that does help?
Sure. Music therapy is something unique that we are able to provide as an adjunct to traditional therapy at Spectrum Health. We have a couple of music therapists employed with us, and they work in a couple of points across our continuum. But I personally have worked side by side with the music therapists, and we've been able to use music to facilitate movement, to facilitate stepping. You know, that the rhythm of stepping has been helpful. Music that builds in sound and builds in like an ascending scale might help a person to build their movement. You can also think about it from a speech-language perspective, and the use of song has been able to get a person to get that first word out, maybe. Not to mention just attention. People are able to pay attention to music and really enjoy that, especially those who have a musical background, but really many people have had benefit from music therapy as an adjunct to their physical, occupational, and speech therapy.
You talked about your specialty being brain injury and things like that. So when you're talking about music and programs like this, what is happening in the brain that feels that stimulation that is helpful and leads to that road to recovery, you know, while that specific thing is being done, like music or something
part of
else?
Brain injury rehab is trying to tap into a variety of locations in your brain. So music therapy, the interventions that we provide and that we've been taught and researched to provide are trying to tap into a variety of locations within the brain and get them to all work together and kind of rebuild those connections is how I think about it and how I try to explain it to patients and families.
When you think about brain health, it's so important, and we're doing things to try to treat our brain the way it should be, kind of stimulate it if it has been affected by something that has happened. How do we strengthen our brain health?
Well, you can think about your brain like any other muscle, really. So like any muscle, you want to challenge it. You want to make it work harder. So don't let it just sit there and get weaker.
Get a little dusty, right?
You know, dust off those cobwebs. So try something new, you know, try to learn a new skill, get out and volunteer, be active.
I know, like puzzles and things like that are extremely helpful when trying to create memory and stimulate the brain.
Right. And just a healthy lifestyle not only makes your body healthy, but also your brain healthy. So making good choices when it comes to food, when it comes to exercise, you know, use of helmets and seat belts and those types of things are all along that can be included in that list of helping to keep your brain healthy.
We really touched upon music therapy, but I know that there's also a great program looking at art at Spectrum Health, a lot of other things too. And so it's really great to know that there are a little bit extra kind of things going on. If someone wants to learn a little bit more about your programs or what you're doing about rehabilitation at Spectrum Health, how would they do that?
Well, they could look on our website. Spectrum Health does have a very good website with a lot of details, a lot of phone numbers, a lot of websites listed there. So that would be the place I would send them, is to look on the website and find lists of all of the programs that are listed there.
Yeah, well, it's been fun talking to you. We've learned a lot about the different options that are available when it comes to rehabilitation.
Good, thank you.
We'll be right back with more at West. Don't go away.
Are you West?